picture of her and her mother. I'm meeting you for coffee.
Okay.
And just chatting about the things that concern us.
Stories allow people to, for a moment, right? I mean, have a little glimpse into perhaps what it is like to be in that position.
I can write about homophobia in my life in ways that no interviewer could ever capture.
I don't care who you are, you have to live in the world and you have to figure out the world.
That's what qualitative inquiry is about, isn't it?
Well, it's enriched my life.
I'll tell you a little bit about me. My name is Djenane Oliveira. I come from Brazil. I'm a pharmacist or a clinical pharmacist, and I've been in this profession for many years. I teach in a pharmacy school. I teach this course. It's called social pharmacy. Care is a way to really train pharmacists to be clinicians working directly with patients in collaboration with other healthcare providers to pretty much understand how patients manage their medications on a daily basis. So what they feel about it, how those feelings, those experiences change what they do on a daily, because you really change what they do. So in this class, the social pharmacy, I started introducing some pieces, qualitative pieces about patients' experiences with medications or the meaning of medications. The kind of skills that we have to teach in qualitative research methods, for example, active listening, how to pose open questions and interesting questions, how to use your body language so you make your participants comfortable, things like that. I'm giving a few examples. These are the same skills we need to engage with our patients and listen to them and understand what their needs are so we can work with them to
Asking Djenane a few questions about wonderful presentation. I really enjoyed that. So can you just distill some of those things that you just said for me, that you found teaching qualitative research helps students who are going on to become pharmacologists in some important ways? What ways were those?
We want to prepare pharmacologists or clinical pharmacists, or we also call this medication management pharmacists. We want to prepare them well. We want them to be competent in drug decision making, how to make decisions about drugs, how to help patients and physicians, but we want them to do that differently from what we've been seeing in healthcare.
So what's the matter with what's been seeing in healthcare?
Yeah, that's a good question. I think we're still in an old paradigm. We still believe that the professional has the knowledge and we need to impart our knowledge on patients. Like they're there to learn, they're learners, we have the knowledge, we are the teachers. And it's not about that. Like I really try to instill my students the idea that we are all learners and we are all teachers.
Yes.
I mean, patients have a lot of knowledge that we don't have.
Yeah.
I mean, we have no idea what it's like to live with a chronic condition or to take 20 pills a day. I mean, a lot of our patients take from 10 to 20 medications a day. I mean, what is it like? Like, how can I work with someone and help someone that if I have no idea what it's like to live like that? So we are really trying to bring the patient or the human being, at forefront and make them a partner. I think the same thing we're trying to do with research, really engage our participants in a co-construction of our knowledge and including them in the process.
I think qualitative research really plays an important part in that.
I think it's key. I mean, if you want really to have someone that will follow this path with the patient, alongside the patient, to make sure that he's making the best possible decisions for him. We can do this in the old paradigm, meaning, I have the knowledge, I'll give you information, and that's what we have been doing, I think, in pharmacy a lot, providing information. We know this doesn't work. It's not about providing information, it's about understanding where you were at and, take you from there and help you in the process. And qualitative research will help us to build these skills that we need to be this person that you follow that, that you listen, that will take into consideration where you're at in your situation without judgment, being open to that. So it's building a different kind of practitioner.
So tell me, last time when we were talking about pharmacy, you seem to have a real passion for your students that came through your work.
Yeah.
So how do you bring that into the classroom? How do you teach them qualitative research and introduce it to them?
I see them as my collaborators. Yes, we are talking about collaborative writing, which a lot of you guys do here, and I can say that I do that with my students. So they are the people that I collaborate with.
So when you collaborate with them, what does that mean? What do you do?
For example, a class that I'm teaching now, and I've done that many times with different subjects. It's a creative and evocative writing class. Pretty much tell students, okay, there is this thing like autoethnography or evocative writing that I'm interested in, and would you like to learn with me? I mean, the first thing that I talk is this class is about vulnerability. I learned that's a very important word if you want to write and talk to other people, and so people can see you speaking, kind of performing, and also listen to what you have to say.
So how do pharmacists make themselves vulnerable?
That's a good point. You mean in their work?
Yes, so how do they touch the vulnerable nerve? Because they're quite distant, neutral, strong.
Yes.
Okay, and you're saying be vulnerable. How do they find their vulnerabilities?
I think they found their vulnerability by understanding that they don't need to know everything. They don't know everything. I understand that if you want to work with the other, meaning the patients who take medication, someone who is taking a bunch of medications, we need to have access to their world. We need to work with them. We need to understand where they're coming from. And if you really like to open up yourself as a pharmacist or as any kind of professional, you need to be vulnerable too. Like, that's okay. I mean, you might share your own experience, take medications with patients.
So you would ask them about their medication?
Experience, actually, yeah. So they write, actually this class is about that. I mean, we go much beyond medications and drugs and all that stuff, but we talk about, and I let them go until the point that they want to go. For example, I ask them to talk about, an interesting experience they have in their personal life that they might connect with taking care of patients. And like I had a student talking about, their relationship with their parents, or their relationship with parents that had mental illness. So I tried to open space for them to be themselves and to talk about themselves, to write about themselves, and feel vulnerable, and that's okay.
What do you do with that writing?
If they want to share, they share, and usually they do.
Really? Yeah.
Yes, usually they do. I was very surprised this last semester. It was very powerful. It was one of the best classes I've ever been in. Not that I taught, because I don't feel like I'm teaching, really. I'm just facilitating and really creating a space, because it's you have to think that we are in a pharmacy school. Like they've never experienced anything like that. There isn't much room for that kind of environment. So they really felt, they were very thankful that we had that, and now I'm teaching that again next semester, and I had people that were there last semester that want to come back and ask me if they can be there, and I said I would love that, because it'll be different. Like,
absolutely,
the people there will make the class. So that's one way. I think that's really been amazing experience for me. Actually, I'd like to write about that class, because I was amazed how much people came out. Like, I had students talk about their sexuality, being gay, about relationship at home. All kinds of things came. And what I did, I think that facilitated, I started the class with a very personal performance. I read a little piece about when my brother died. So I really showed them what vulnerability is, and every time that I talk about my brother, I cry. So I cried. So they had a teacher crying for the first day of class. So I'm like, okay, after
unheard of.
Anything can happen here.
Was that difficult for you then, to open up to what were at that stage strangers?
No.
Honestly, I think because I've been teaching for so many years, and the way I am with the students, I think I don't know, I'm too open to them. I don't think, I really feel, those initiatives that we must have so they will decrease the power difference between students and teacher. I think I've been doing this for so long that I don't feel that too much anymore. Actually, I have difficulty to say, I'm going to grade you. I'm like, oh, I don't like that anymore. I really like to create environment that, they feel that we are colleagues. So that's hard sometimes because this is a graduate level class. The other class that I teach, which is the pharmaceutical care class, it's the clinical practice class, which I spend 67% talking about human beings, building the foundation for them to come with the decision making and the pharmacotherapy. I do that. That class, I grade them. I need to make sure that they know the concepts before they leave the class, which are major concepts, more important for taking care of patients. But so I'm a little tougher, but I can't be too tough, I think, and my pedagogy kind of reflects what I believe they should be with other people. So, and of course, I really thought about that a lot 15 years ago when I created this course, to do that, because I was not that yet. I wanted to be that. I don't know if I still
what do you
am.
see? How would you, 15 years ago, differ from you now?
I think it became who I am in class.
Yeah.
I don't force myself, don't push myself. It's just I'm genuinely interested in them. I really want them to be in charge. I really want them to be empowered. I was just reading what some students keep telling me, and I have notes for 15 years. I asked them to reflect on the class, and I have kept that. I had one student say, this class is the cornerstone for who I am today. It changed my direction. Now is just a professor of pharmacy. It's not that this class starts everybody. Of course not. I know it's impossible, but I really feel that it has an impact on several people, and I think that's enough for me. I always say, as a teacher, if you touch one person, that's good. That's a good result. And I think it made a difference for many people. And now these people are in practice. They are professors. They are researchers. They're everywhere. And I see what they're doing and how that reflects some of what we've worked in our class. It's been very rewarding. And as we talk about qualitative research and that, it was instrumental in making this class what it is and make me the kind of teacher I am, because I use the same skills that I need to be a qualitative researcher, a good qualitative researcher. I need to be a clinician. I need to be a teacher. I think it's all connected. So for me, it all happened at the same time. Me learning about, okay, we need this laws of practice to work with patients. I need to know where I'm coming from, where I'm going, my direction, and then as a scientist, as a researcher, I need that foundation too, and as a teacher, I need that too. And really, I realized all that at the same time. It was crazy. You can imagine, it was really a lot, but it's all connected, and qualitative research is a big piece of that.